Okay, my name is Dr. Tom Smith. I'm a chiropractor in Bellevue, Nebraska, and I've been there for about a little over 11 years now. And I've known Paulette for actually almost the entire 11 years now, because I used to teach at another massage therapy school. Anyway, Paulette asked me to speak because there are different ways that chiropractors approach things, different ways that we work. And mine's just maybe a little bit different from the people that you've talked to or have had speak to you before. So we're going to kind of just go over my general approach and how different techniques and how they can be used, integrated into massage therapy possibly, into how it can apply to you. And also if you work with a chiropractor, you can see how different ones work and know who to refer to. So, visual aids here. Okay. When I approach a problem, usually do what we call the home run for health. You baseball people in here. If you're going to hit a home run or score a point, you have to do what? Okay, boy, this is really good. So you have to what? Someone said it. Hit the ball. Well, yes, and then you have to do what? Run the bases and hit all the bases. Okay. So, in general, if a person has a problem that walks into your clinic or into my office, there are 4 major causes, excluding genetics, of what brought this person to this point, okay? And those are emotions or emotional, toxicity, nutritional, or we can call it biochemical, and finally, structural. 4 different causes what could be brought this person to the point that they are where they sought your care. So we're going to talk about each of these and how these can be approached, and I'm going to show how it's integrated into my office when a person comes into my office. Okay, nutrition or biochemical. You've always heard what you are what you eat. Okay, I think you guys, have you had nutrition already, most of you? Well, the body can only do as much as best it can do with what you give it to work with. Okay, so this talks about deficiencies that a person has in vitamins, minerals, what have you, or eating the right type of diet for you. And there's a lot of different things out there. We tend to, in my office, I tend to like what's called the Eat Right for Your Type diet. Have you guys heard of that before? More or less, for most people, that works pretty well. But sometimes you have to also find out there's certain types of, I hate to say allergies, but sensitivities that people have to different food. You need to figure that type of stuff out also. So sometimes when a person comes in your office, they are so nutritionally deficient that you have to give them nutritional supplementation of specific types. It may not just be vitamins, but it could be also digestive aids, what have you. You know, our food that we eat now is not the same as it was, 80 years ago, the way we farm. There is a difference, between organic and non-organic stuff. You know that, right? When they analyze it, the nutritional content is not the same. So because of the way the people eat, sometimes they're just so deficient in minerals or vitamins that you have to supplement them, or otherwise they just don't hold their adjustment. A lot of people are calcium deficient, so they will tend to have muscle spasms, and you work on them, and you get nowhere. They just may need some calcium. So we take this into account when we work with a person and also help them get into the right type of diet to eat. Toxicity. Oh, let's go back this for a second. Also, it's not just not getting the right stuff, but also sometimes eating the wrong stuff. Everyone talks about the big obesity epidemic. Do you know about when that began to change? No? Okay. Really about the early 1980s is where we started to see things change and more and more diabetes. Well, the only big thing that happened around that time is that for sweeteners, we changed from sugar to more corn syrup based stuff. And it's been since then that things have kind of taken a nosedive with health. And that may be a big part of it with people. If you look in ingredients anymore, look at them. High fructose corn syrup. It's your pop, that's how it's all sweetened these days. So you could be eating the wrong stuff too. Okay, going back in reverse here, toxicity. It used to be, in chiropractic, they talked about actually a triangle of health. They talked about structural, emotional, and biochemical. And we didn't have to talk about that. But they're getting to the point where they didn't get some of the results with patients that they used to get, and they're wondering why, what changed? Well, they finally figured out is that we live in such a toxic world anymore with all the chemicals in our environment, pollutants, etc., that sometimes the person has toxicity issues that you need to deal with it. The best way to deal with that is homeopathy. Now, have you guys been exposed to homeopathy at all? A little bit, okay. No, some say yes, some say no, okay. Homeopathy actually in the mid-1800s, late 1800s was pretty much on a par with organized medicine here in the United States, and over in Europe it's still pretty big. Homeopathy uses dilutions of herbs and other substances that if given in the same full strength would cause the same symptoms that you're trying to get rid of. So for example, if someone has a fever, okay, or inflammation, well, you give them a very dilute amount of an herb or substance that would cause a fever or inflammation if you gave it in full strength. You can give, for example, homeopathic, well, we're selling it right now, homeopathic flu virus. It's just the influenza. It's just a very dilute amount of flu vaccine. Actually, there's diluted so much that if you analyze it, it's not there anymore, but the energy pattern remains, and you can use that to help detoxify a person from the flu virus. There's homeopathics for many other different things. There's whole repertories of stuff that you can look into. So sometimes people are so toxic from things, bacteria, viruses, metals, chemicals, that you have to give them a homeopathic to help them get better. Emotional, okay. This is also a big thing. You know how you can think yourself sick, right? Okay. Stress can cause a person to get sick. Well, a lot of times you have to address the emotional aspect of what brought the person to this point. And I'm going to demonstrate that on you, on some people here pretty soon. And these, I tend to use what's called applied kinesiology to evaluate a person. Has anyone ever had applied kinesiology done on them, or know what I'm talking about? Or, okay, a couple people, okay. Sometimes called muscle testing. There's there's a lot of different forms of it. And there's a form that's for the lay person called Touch for Health. Have you ever seen that? You can buy the Touch for Health book at Barnes & Noble and Borders even, okay. Actually, it's a very good book. That's something you can very much integrate into your massage practice and will help greatly. So I use that to assess where the person is, and I'm going to show that in just a little bit here. Structural, well, that's the main thing when a person thinks about a chiropractor, massage therapist that you work with, the joints, the muscles, etc. Now, whenever you go to a different chiropractor, and even within the same chiropractor, they don't all work the same every single time. There are well over 100 different named techniques in chiropractic. Some work better for some people than others. I think that's why all of them developed, because some work better for some people. There's a couple main ones that everybody learns. These are called like diversified, is what we learn in school. What's the manual type? But you know, even among the manual types, there are a lot of different ones. If a person said adjust C7, well, I could off the top of my head probably figure out 8 or 10 different ways I could adjust to C7. Okay, there's a lot of different ways you can address stuff. There are higher force techniques, lower force techniques. One of the big things I use in my office is, in my pocket here, an activator. Anybody ever seen one of these? Okay, this is a spring-loaded instrument. It gives a quick, controlled thrust to the spine. They've been doing lots of studies, and they found that maybe one of the most important things is not the amount of actual force that's put into the adjustment, but more the vibration that's induced into the joint, into the bones, that's actually might be a little more important, because as you get to a certain threshold, you'll excite more of the proprioceptors. Remember what proprioceptors are? Yes? No? Okay, probably says you better. Okay, proprioceptors, actually, proprioception is a huge, the brain deals with a huge amount of proprioception. That's probably one of the major things it deals with. Proprioceptors are receptors in joints and muscles, including such things as Golgi tendon organs and muscle spindles. Remember hearing about those? Okay, that monitor our position in space and also our movement. And based upon the information the brain gets from those, it can then respond appropriately for movement, posture, what have you. Now, if for some reason it's getting bad feedback up there, and the feedback is monitored in areas such as the parietal area, the cerebellum, if it's getting wrong information, responds incorrectly. It interprets it as pain, for example. It will cause muscle spasms. Sometimes it will cause laxity in some areas. So in order to correct that, we give chiropractic adjustments to try to reset the proprioceptors to get the right information flowing back to the brain. And as you guys give massages too, you're working with those Golgi tendon organs, you're working with the muscle spindles, and you're helping to reset them to, once again, get right information back up to the brain. Most research is showing that most people's problems at the core are not peripheral, meaning in the muscles, the joints, whatever. Most people's problems are actually central, meaning central nervous system, brain and spinal cord, because it's an integration problem, okay? If you learn how to do that correctly with your massage, make good results. And I'll show you a couple little things here, a second of freaky things you can do. Okay, so structural. And there are other techniques called, we ever had blocking done, sacro-occipital technique? Anyone ever had that one done? That's not as big as it used to be, but that actually developed in Nebraska City, of all places. So I think what I'd like to do is just give a demonstration of what I might do with a person and kind of maybe take questions from there. Actually, any questions right now? No? Okay. Anybody have a problem that just has not been responding to anything lately? Hi.
Hi.
You are?
Jen.
Hi, Jen. Okay. Now, to begin with, when I assess a patient, and this actually kind of bleeds over into the acupuncture type stuff too, which, you know, where do you put acupuncture in that? Well, you know, I've debated that. It may be kind of overall the whole thing, but it's kind of maybe like a parallel system to the structural or the anatomical, so I may put it in with a structural type thing. Is the whole thing of applied kinesiology is based upon the premise that the body is electromagnetic, which I think you guys all understand that, okay? And by forming a simple circuit with the patient, you can kind of plug into different acupuncture points or spots that correspond with different problems. And if there's a change, there's maybe some problem there. So, first thing I usually do is just find out if they're running, if they're up, you know, if they're able to have a current going in the body. Okay, so I'm gonna try to press down, but I want you to resist.
Okay.
Hold. Okay. Now you see how you lock right away?
Mm-hmm.
Okay. Now there's a polarity point right here. Either here or here, when I touch it, she should go weak. If not, she's in deep problems here. You see the difference there? Okay, try to keep it up. Yeah, see, you can't keep it up, can you? Hold. There she can. That's good, she's testable. Okay. Now, we're going to actually kind of scan through her spine, because every time you have a problem with the proprioceptors there, a subluxation, which is what chiropractors call that area in the spine where you're getting the bad feedback, anytime you find that, there's a disturbance in the electromagnetic spectrum. I can try to press down, but don't let me do it. Hold. If your arm gets tired, let me know. Check the C1, C2, and C3. C3 right there. Okay. So at this point, there's a problem here, C3 on the right side. Actually, is that tender there too?
Yeah.
Okay. I first want to find out if it's maybe some emotional stuff with this. So why don't you put the palm of your right hand on your forehead for me, please. Hold. Okay, what happened there?
I don't know. It's not going down.
Yeah, it got strong. Okay, which tells me she's got some emotions wrapped up in that. Why don't you take that off, okay? Okay, and it just goes weak again. Okay.
Surprise.
Yeah, okay. So we'll go back to that, okay? Now, there are two acupuncture points here, and I want you to take these two fingers with their right hand and just stick them, yeah, let's just put that to the side, Jen. Right there, okay? This checks to see if there's any toxicity there. Hold. It didn't change anything. So she doesn't need a homeopathic for this specific problem. Now put your fourth and fifth fingers there. There you go. Hold. Okay, actually, that does go strong. So nutritionally, there's some reasons why this is perpetuating. My guess would be either she's eating too much sugar or she's deficient in minerals or something like that. In fact, hold. I'll check one thing. 2, 3, 4, 5. And sugar, carbohydrates. Okay. Is that pretty tender there too? Mm-hmm. Yeah, okay. So, I mean, in my office, I might actually test her with a couple different things and see how it changes that also, but we're going to probably just do some nutritional consultation to begin with. Okay, so let's go back to the emotions. Okay, now, if you want to stop anytime along here, you may do so, okay? You don't have to do it, okay? Let's reactivate stuff. So, put the palm of your right hand on your forehead for me, please. Hold. Okay. So at this point, I tell the patient, your body seems to be saying there's emotions involved in what's going on. So I'd like to do a procedure to try to find out what might be causing it. So first thing we want to do is find out what this has to do with. And there's usually three main areas that people's emotions revolve around: how they relate to things, to people, or to themselves. So we're going to kind of go through those, like things like money, job, finances, career. She's strong. Usually, and if you say something that the body subconsciously knows, it gives like a little jolt to like, that's it, you know, and it goes weak. So there's nothing there. So let's check people, like everyone you've ever loved or everyone who's ever loved you, and there she goes weak. Okay, let's check you. I think something intrinsically about you. She's strong. Okay, so within the category of people, there's two broad categories. There's family and friends. Hold. There's family and friends. Family, family. Okay, there's the family that you now have. Family you came from. Family you now have. Okay, so at this point, we're going to start naming people. So, name some people in your family right now. That.
Chloe.
Chloe, no?
Megan.
Okay, just a second. Okay, something's getting hot here because she turned off. Okay.
I'm embarrassed.
Well, that may be. You know, if you don't want to do this, we don't have
No,
to
it's
do
fine.
it. Okay.
It's okay.
Okay. Okay, so who again?
Chloe,
Chloe. Chloe. Okay, Chloe. Who's Chloe?
my daughter.
Okay.
She's in puberty. She's driving me
Okay.
crazy.
Hold. Hold. Now, do you think that might stress her out and cause her to give headaches? Okay, so Chloe. So at this point, I tap into, you know about the pulses, the acupuncture pulses? All the different acupuncture meridians. You guys have been exposed to acupuncture already, right? Kind of. Okay, there are 12 main meridians and then plus the governing and central meridian. All those meridians correspond with emotions too, because the Chinese believe that emotions can be just as destructive to your health as a virus or bacteria, what have you. So I'm going to kind of tap into those and see which meridian this is affecting, and then we'll try to figure out what this specific emotion is. So hold. So Chloe. Okay. Chloe. And Chloe. No, it's not that one. Okay. Hold. Chloe. Hold. Chloe. Hold. Chloe. Hold. Chloe. Okay. Chloe. 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 It's this one. Chloe. Okay. This is gallbladder point. Gallbladder or liver. In fact, let's just see. I've been a little tender there too. Yeah. Okay. So emotions with the gallbladder. Hold. Are anger. Hold. Are you getting tired there? Okay. Hold. Anger, resentment, irrationality, frustration. Hold. Frustration. Okay. So your frustration with Chloe. What specifically are you frustrated about Chloe?
She's not studying. She's not behaving. She's emotionally chaotic. She's going through puberty.
Okay.
She's a beautiful child that's driving me nuts.
Okay. So you're frustrated because you have problems controlling her, because you.
She's struggling, and when she struggles, I struggle with her.
Okay. You're frustrated because she's struggling, and you
She's
don't.
not applying herself. That's what frustrates me.
And you're frustrated because she's not applying herself. You're frustrated because you can't seem to help her. You're frustrated because you can't seem to help her. Okay. Now there's a lot of ways I can go from this to here. Okay. I can do the immediate problem, or sometimes I can just kind of delve back into, relax for a second. People have basic assumptions that they operate on throughout life. Okay, usually it's mainly just crap that they picked up when they were kids from mom, dad, or whoever, about how they see themselves or how their place in the world. I have a feeling she's got some crap here that we have to get at the basis of. Okay, so we said it was frustrated because she can't help it. Okay. We're going to check some stuff to see if she's congruent or what she believes in. If she says something she believes in, she's strong. If she says something she doesn't really, this is a good way for check on your kids if they're lying too. I mean, I got another 6-7 years before he does. Yeah, but okay. I had friends who did this, and their kids anymore, as soon as their parents said, "Put your hand up," they confessed right away. That was good. Okay. Okay. So, say I have to help everybody.
I have to help everybody.
She believes that. I can fail just one person in this world.
I can fail just one person.
Okay, do you feel like sometimes like you have to, is she the type of person who has to help everyone, or I don't know about her or not? Does that seem true to you, or?
I neglect myself to take care of
everyone else.
other business, yeah.
Yeah. Say, my needs come last.
My needs come last.
Say it again.
My needs come last.
Okay, she doesn't quite believe that. Okay. But my needs are secondary.
My needs are secondary.
That, okay. But they don't maybe come last, but they're down the line here. Okay, okay. So, wow. I said there's so many different ways we can go at it. The art of this is, I usually call it finding the little air shaft in the Death Star, if you guys know what I'm talking about. Okay, because you can be dropping bombs all over it and you're not going to get anywhere, but you find that one thing and you explode the whole core and you get rid of it. Okay. Okay, well, let's see, let's go back to, I have to help, frustration because you can't help her, right?
Yeah.
Okay. Okay, let's just get some original thing here. Okay, what we want to find is where she got this from. So we want to find the constant original event in your life in which you were frustrated because you could not help someone. There is one. Okay, when you were conception to age 5, conception to age 4, crap, I know it's going to conception age 3, conception age 2, conception age 1, conception to birth, 1 month in utero, 2 months in utero, 2 months in utero. Okay, it sometimes comes up. Okay, you guys ever heard of a vanishing twin before? Discover magazine. Okay, honest to God, a couple years ago they had a thing about this in there, so it is true. I'm not making this stuff up. Many times, yeah.
And it works with positive, negative emotion too, right?
Yeah.
Like when you have a positive emotion like love, something like
Yeah.
that, your arm is strong. But if you have a negative emotion like hatred, jealousy,
You can go, yeah.
there is nothing there.
We always do this in more of a positive rather than negative stuff, but yeah. Well, when we talk about vanishing twins, a lot of times when a woman gets pregnant, there's not just one egg that's fertilized that develops. A lot of times there's 2 or more. Okay, so, but obviously one of them doesn't survive. Okay, so it's a vanishing twin, that you had a twin in there with you who didn't survive, didn't make it. However, imagine, here you are, that little fetus just floating around in there, but the other person was the only other person in your entire universe, okay, that you knew, sensed, besides mom, okay, but it didn't make it, okay. Sometimes some of those things are very powerful underlying motivators for people. I've had some hypnotherapy stuff done on me where it's brought some stuff up too. So and other hypnotherapists have said that's come up on different work they've done with people too. So it can occur. So what her body seems to be saying is when her mother when you were just 2 months along in the womb, you had, well, I don't know if it's a twin or a triplet, sometimes it could be more, that probably didn't make it. But more than likely, she was stressed out because she was trying to save this thing. And ever since then, she thinks she has to save everyone else or help everyone else in the world, but you can't. Stuff happens. Okay. You feeling okay?
Yeah.
Okay. Sometimes, I don't know, sometimes the people, it rings true to them when I say it, but
Well, I
yeah,
don't know.
you don't know. But some people, you bring this up and they just start crying because they just like, oh, I knew this. Okay, so concept at 2 months in utero, you had a twin. Okay, male twin, female twin. So you had a sister in utero.
I don't have any sisters.
Okay,
in life.
In life, yeah. But it was saying is that it was a female, yeah, but didn't make it. Okay, so concept you were frustrated because at that point they were going away and you couldn't help them. Yeah. Okay, you couldn't figure out a way to do that. Okay, so that's what our body seems to be saying. So I'm gonna do a little correction here. It's deep. Okay, what I have you do is hold deeply on this point, which is the liver gallbladder point. You put your palm on your forehead. And what we want to try to do is try to recreate the emotion to get it up and flowing and moving around. So I want you to kind of imagine what it'd be like there. There you were in the uterus, and there was your sister, the only sister that you probably ever would have had, and she didn't make it. Okay? And how maybe you tried however he best could to save her, but it didn't work. So just think of that frustration that you might have. Best of your ability, it did not work. And when that feeling starts to fade, let me know.
Okay, my heart seems to not be racing so
Yeah,
much anymore.
yeah, your breathing changed, and that's how I knew you were done with it. Okay, okay, let's check this again. Hold. Now turn your head to the left. Want the concept of any other motions with this? Look straight at me. Okay. See, right now, energetically, this is okay. You still might have some stuff out structurally. Still pretty tender, or is it less?
It's less, but
See, I didn't even touch her, okay, and already it decreased it. Her brain is not firing in such a way, stress-wise, to hit her right there. Okay. Say, what was the thing I said? I have to save everyone, was it, or? I have to take care of everybody.
I have to take care of everybody.
See, now she's weak in that. That specific aspect of what's driving her in life hopefully is not there anymore, okay? So it doesn't mean that she will make the choices to, that she will not act on that anymore, because that's pretty patterned into her, but at least now she has a chance to not do it. You know how some people just continually repeat stuff over and over and over, okay? Like people who, some people who find the wrong person all the time in their relationships, okay? It's called repetition compulsion. Okay, psychology, remember repetition compulsion? Remember that? Huh? You didn't touch it? Okay, repetition compulsion is that you are compelled to try to recreate a scene in your life to adequately bring it to resolution. But when you don't, you have to keep going over and over. Like, for example, you had garbage issues with your mom, okay, or with your dad. That's a better one, okay, for you. Let's just say for you, issues with your dad. You keep seeking out men probably who like your dad, and you don't resolve it with them, and so you keep getting the same crap over and over and over and over with men, and you never resolve it to have a good relationship with it. Okay, that's for example. I'm not saying that actually that happens with you.
That was
okay.
until recent, until the last few years when I finally just let it go.
Okay, you see, she learned to let it go. Okay, this procedure can help you do that. It's not a replacement for counseling, but at least it makes it so physiologically it's not driving you to do that. You can now say, oh, I don't have to do that. And some of my patients said it helps them in the counseling get to core issues a lot faster, okay? So that's one way I do with emotional stuff. I also sometimes use it for people for success coaching. Okay, some people, how they just get to a certain point and they fail, okay? I had a real estate agent come in to me that she always got the point in making the deal, and she dropped the ball all the time, okay? We just had to work on some, because her only goal was to earn enough to bring her kids to Disney World, okay? So we just worked on that. She's making enough now. She's checking Disney World, okay? There's different ways you can use it for success too, to find out where people defeating themselves, okay? So that's the emotional type stuff, okay? Have you been adjusted before by a chiropractor? Mm-hmm. Okay.
Not for a while.
I know she's still out, even though it doesn't. So the only other thing, only other thing I do, can I use this on you?
Sure.
Okay. Just use an activator in this area. Okay. Okay. Here's a little thump. Okay, hold. Yeah, nice and strong there. And I could probably go on down the rest of the spine. She's got stuff going on through here too. And she's got some stuff going on here too. Oh, okay. That should not show up. People ask, can you muscle test a pregnant? No. Muscle testing shows things are abnormal. Okay, so that's an abnormal, that's a normal thing. So it shouldn't show up unless there's something like the uterus malfunctioning or whatever. So anyway, okay, any questions so far? Thank you.
Thanks.
Any questions so far on any of that? Okay, I need another volunteer. Muscle spindles, Golgi tendon organs. You thought, why do I need to know about these things? Okay. you can use those to change the tension or tone in the muscle. Okay. Golgi tendon organs function to protect the muscle or muscle tendon from ripping. So if you're carrying something really, really heavy, you get enough tension on the biceps tendon, the Golgi tendon organ is there, and what will happen if you're carrying something too heavy before you rips? You'll do what?
Shake.
Well, before that, you'll drop it, okay? When you get enough tension on there, they have what's called reciprocal inhibition. It'll come around and it'll just make them go weak. So you can work on those Golgi tendon organs, put some little stress on them to make the muscle go weak. So let me think here. I don't usually do this often in my office, so I have to think about the right way to do it. Okay. Golgi tendon organs are located where? It's not a trick question. Tendons, okay. So like for the biceps, where the tendons be? Here and here. Okay, well actually there's two. There's a long head, short head. Okay. Okay, what's your name?
Yananta.
Okay, Yananta. Okay. I'm gonna try to press down, but don't let me do it. Okay, so I just checked her biceps. Nice and strong. Okay. Let's say, for example, that this was spastic, too tight. Okay. You can get up on these tendons. If you want to stress the Golgi tendon organs, you do what? Give a little tug on them. So I get towards the end and just quickly. Okay, hold. You give a little bit more. Okay, let's see if this works a little better for you though. Or you got the muscle spindles, just shorten them. The muscle spindles are where? They're in the belly of the muscle. Hold. Yeah, well, you don't show as well as some, but you know, you feel it's a little bit givier than it was. Okay, do the reverse if it's, so for Golgi tendon organ, you get on the opposite ends of it and you lengthen it if you want to weaken the muscle. Let me write this down, otherwise I won't get it right. For Golgi, you basically lengthen the muscle or tendon. Sorry, my handwriting's bad. For the muscle spindles, you shorten them. So, let's say someone has a spastic trap or something like that. Okay, if you want to weaken, you can get like on the ends of it and do this type of thing, which actually is kind of an adjustment in chiropractic. We go like that, okay? Or, you know, the muscle spindles more in the belly, towards the center, and push in like this. Now, if you have a hypotonic muscle, to strengthen, it's just the opposite. You shorten the muscle, or lengthen, or pull apart. So let's say you want to strengthen the biceps. If you want to strengthen it, you would pull apart on these muscle spindles, or you would come in on the Golgi tendon organs. Anybody have a shoulder problem? That would actually be easier. Okay, you way in back there. Like, no, I mean like rotator cuff thing. Okay, okay. Someone's, okay. Thank you, Yananta. Okay. I'm getting tangled up here. Okay, let's just see which one. Okay, I'm gonna try to press down, but I want you to resist. Hold. See, that's not too bad. Okay, I'm gonna try to press in, but don't let me do it. Where's it hurt at?
Mark, let's see. Yeah. Right.
Oh, you got an AC joint though. That's not exactly what I wanted.
That's it.
Okay. I'm gonna try to press down. Don't let me do it. Not exactly wanted. So you have rotator, but it's not the muscle weakness. It's just the AC joint that's the problem here. So anyway, okay, I want another person. Thanks anyway though. okay, you then. It's the problem, but not the problem I want. So, and you're Kelly, and which shoulder?
This one.
Okay, we're talking about like right here.
Yeah, like all through here, all the way through.
Okay.
Especially.
Okay, I'm gonna try to press down. Hold. I guess I can work with a pick. That'll do. Okay. I'm gonna try to push in, but don't let me do it. I'm gonna try to push out, don't let me do it. Okay, I'm gonna try to push down like this, but don't let me do it. Okay, I'm gonna try to push this way, but don't let me do it. Okay, that's where she goes weak, okay, the pec. Okay, so if I want to strengthen it, I can do what? Well, I'm gonna use the muscle spindles in this one because this is actually a little bit easier because you don't have you have like a huge tendon, broad tendon for to use the Golgi tendon organs. So I would get on like right in here, okay, and just start to pull apart. She probably has some ribs that are out of alignment, but okay, let's try this again. Hold. It's a lot stronger, isn't it? But I can still overpower it some, so I think you have.
Right there.
Yeah, she's got some pec minor stuff too, which pec minor is much shorter, so. Sorry. Okay. Hold. Now that's a lot stronger. Okay. Yeah. Tender there too?
Yeah.
It's there. 3. Okay. Not so much there, but there. It's your second rib. Okay. Do you mind if I give? Have you been adjusted before ever?
Never.
Do you mind if I
Yeah,
do it?
I have been.
Okay. You don't have to. Okay. It's going to do a rib adjustment. Okay. Step away from here. You see, when I do the adjustment, okay, I shorten the muscle real quick. I work more with Golgi tendon organs. Okay. Hang your head forward. Trust me, I have not dropped anyone yet. Okay. So, okay. Bring your head back. There we go. Good. Now, this should be a lot more permanent though. Hold. Really rock solid. It's tender?
Yeah.
Still tender, but, because you probably have a little information there, but just move it around a little bit. How's it feel?
Much better.
Okay, yeah. So just resetting the spindles. I gave her, now she has correct information coming from her pec minor, her pec major, and her whole general shoulder area and the ribs. Okay, so it's going to function better. She's going to feel better. Because a lot of times it's also noise. All pain goes through what specific part of the brain? The what? Thalamus, okay? It's just noise to it, but when you get to a certain threshold, it actually says, oh, pain, so, and then you interpret it as such. So we just kind of lower the amount of noise coming back, okay? You get to a certain threshold and like, okay, this is painful now, so now we just lowered how much is going back up there. Okay, thank you.
Thank you.
Okay, any questions? I don't know what else to say. As I said, I use my office. Not everyone gets this because not everyone's head is in the place to get this stuff, okay? I mean, well, the adjusting, yeah, you know, why else would they be coming to me? But for some of the other stuff, a lot of people come to me for colds, flus, digestive disturbances, stuff like that, and so I check through stuff. And we check to see, you know, like nutritionally, also checks to see if they need something like herbally, so I check them with herbs, do a lot of homeopathy, things like that. So, so it makes it a little more fun for me because I get to do more things like, oh my God, another guy with back pain. You know, it gets boring after a while, okay? This makes it more exciting for me, okay? And I think it helps you delve a little bit deeper into why they have the problem and then just say, oh, there's a problem here, let's do some stuff on it. So, questions, comments, points, yeah?
So do you have people that are resistant to the muscle testing
That don't like to do it? Oh, I've had a few people who think it's Satan's work, but you know, other than that, yeah, there's not that many, but most people are okay with it, yeah. It's reasonable. And actually there has been, like the technique I did, the emotional stuff, that's actually a named technique called neuro-emotional technique. Unfortunately, you guys can't take it because of unless you have like a health-related degree that's like a bachelor's or above. So an acupuncturist, RN, MD, counselor, chiropractor, osteopath, they can take it. And actually when I go to seminars now, probably only half of it are chiropractors, even though it was started by a chiropractor. But there's a psychiatrist who works at Thomas Jefferson Medical School in Philadelphia. He's been doing some research on this, and he did with a machine, okay, so you can't fake it, to see if there's changes in muscle strength by saying congruent or non-congruent statements. Being congruent and saying like, my name is Tom Smith. I should be congruent with that, although I have had some patients who aren't, which gets into some other wonderful things. Okay, usually adoption or stuff like that. And non-congruent statements. He said, yes, there is a difference in muscle strength by saying congruent and non-congruent statements. So there is published stuff in journals about this. There's going to be more and more. Now they're going to start to do stuff with brain chemicals, et cetera. So it's just taking time. Just like when I started going to school, there wasn't a whole heck of a lot of chiropractic research also. Why? Because no one gave us money to do it. So now we have money to do it, and there's scads of research. So eventually with this, there's going to start to be more research and become more acceptable. Of course, there's some people who think massage therapy is the devil's work too. So there's some people just never going to make happy. So, but for the most part, yeah, people are like, oh, okay, as soon as you explain it to them. Any other questions? Yes?
Do you use x-rays or other diagnostic tools?
You know, I used to, but you know, first of all, x-ray technology is so advanced anymore. Like, you know, I don't want to spend the money for one, and if I really want to see something that badly, I'll send them to get an MRI or CT. So I can find out what I want in a person clinically usually, just by doing an exam. So I don't think it's necessary. You have osteoarthritis, a thin disc. So, you know, yeah, it's the result of this process of the subluxation. So, you know, yeah, so you have arthritis. Yeah, big deal. Okay, it's not going to really change a whole lot in how I treat you. So I usually do it if they haven't responded the way I want to, or if I think what's called the red flags, like, I think there's something deeper here, then I'll send them out, because if there's something that bad, they're going to have to go out anyway. So I tend not to do it a whole lot in my office because I don't adjust off an x-ray. A person does not static all the time. They move, etc. I use the checks that go along with the activator method because it's a neurological check that finds out is there irritation, proprioceptive changes at a specific level. So I like to use that because it tells me where to adjust and even better where not to adjust. I check through some people. I think I just had one maybe today. Check through, wasn't anything wrong. Leave them alone. So that's just important, is knowing when to do something too. So no, I don't do a whole heck of a lot of them anymore.
How long does it take you to do an appointment?
You mean an established patient?
First time and established.
Oh, established, once you know what's going on, 5-10 minutes, doesn't take that long, okay? Depending if they have therapy or not. And I'm not a huge one for therapy. For new patients, anywhere from half hour to 45 minutes. I mean, I don't play the thing of when they come in and they have a mile-long list of stuff to do, because you get nowhere if you do address everything. So you just pick the top things and go from there. And usually, they call it bowling. You'll do a bowl and you'll take a lot of pins out, and then that will clear to see what you need to do. So usually, you can figure out most of the stuff that you need, or what's the most important thing to do within that first half hour to 45 minutes, and take care of it. So you don't need the 2-hour appointments. So, yes?
So do you find that most chiropractors are doing the same kind of thing you are?
No, most are crack, crack, crunch, crunch of different
Still doing
types.
X-rays, still doing...
Well, yes and no. You know, I mean, we're taught in school. I mean, there's some, I don't know. I'm sure you've heard from other chiropractors here, there's differences in how I work compared with the others' work. Some would never touch a person with an x-ray. Well, I don't know. I mean, MDs will give you a prescription without doing blood work a lot of times. You know, you can figure stuff out.
I mean, I'm not saying that's wrong.
No, it's not. I'm not saying it's wrong either. But you know, it's how they choose to work, and they get results. There's a lot of good chiropractors out there. So, if it's just I choose not to. There's for muscle testing, I think I'm just about the only one left in Omaha, and there might be one other, but I don't know. But the other main one, he had a heart attack and died a couple years ago. So, and for the emotional type stuff, there's just me. So.
I know that there's an osteopath in the area that uses it.
Yeah, he does some. Yeah, and actually a friend of mine who's MD, she does it too. So, the local crazies. So. Yes.
You spoke about meridians.
Yes.
Once the muscle operation
Mm-hmm.
and whatnot, do you have to reset the meridians?
Could be, yeah. And
Could you repeat the question?
she said that her understanding was with meridians, if you have like a surgery or a cut where it actually transects the meridian, that you have to reset the meridian. Yeah, sometimes you do. It may involve a needle there or needle someplace else. I was taught a good way to do that is using a laser, which I have one of those, to just work on the area, kind of like sew it up, so to speak, kind of patch the hole. So there's different ways you can do it. Yes, that can happen. And energy can get backed up on one side, depending on how the flow is. So scar tissue is very, very destructive. So using massage to get rid of scar tissue is very, very important, and homeopathy to get rid of scar tissue is very, very important. Any other questions? Nope. Okay, thanks a lot.
Thank you.
Yeah.